Mark Twain famously said that history doesn't repeat itself, but it often rhymes. As we deal with COVID-19, we can hear the echoes of the 1918 influenza pandemic.
I can tell you the 1819 one was pretty nasty.
When what's called the Spanish flu hit America near the end of World War I,
The infections occurred in waves. So just like now, there were a lot of people who thought they were over it when wave 1 passed, and they found out wave 2 was worse. And then wave 2 passed, and then they had to deal with wave 3.
In fact, it's never really gone away.
That virus still exists. I mean, we still deal with H1N1. I mean, it's constantly changing. Influenza's a really changeable, shifty little dude.
These kinds of things, you don't know what to make of them when they first happen.
Joanne Gruber is an epidemiologist who teaches public health at Elon University. She spent much of her career at the CDC and says that COVID is not H1N1 like the Spanish flu was, but they are cousins of sorts.
You have your hamburger and your chicken sandwich, you know. They're both sandwiches, but they're different.
Cassandra Workman,
You teach an entire class in this.
I do.
says society's reaction to pandemics is much the same way.
Today we are going to be talking about the history of medicine. And
She's an anthropologist at UNC Greensboro,
notably both the 1918 flu and the COVID-19.
whose class on the history of pandemics shows that even with how deadly the 1918 pandemic was,
We'll discuss the mortality curve and
when the pandemic began to wane after 2 years,
They did return to normal awfully quickly.
They did. I think people thought, aha, we've solved this thing. We don't have to worry about its return. And then there was the jubilation of, the post-war years where everyone was riding this kind of collective high in the U.S. And so I think then there wasn't the attention needed to how do we prevent this again from happening?
in the 25 months that the 1918 flu pandemic gripped not just America, but the world, there were times it seemed like it would never end.
Particularly in the big cities, because so many young and healthy people were getting it, and it just like now, it overwhelmed their health system. So you had a lot of people, being cared for in gymnasiums and things like that.
In the century since, we've gone high tech.
We have modern healthcare now, and it's huge. Here now, if your lungs fail, you put on a ventilator in an ICU. That just didn't exist then. I mean, you died.
Our science may change, but human nature remains human nature.
People respond in fairly predictable ways. And, yes, I think that there are just patterns historically.
Like, that's something that people might not know in 1918. People didn't like being told what to do, didn't like having their, schools and churches shut down. There were anti-mask leagues in 1918. Yeah, so
they did their social distancing. They canceled big events, but they didn't really otherwise have much. It was basically rest, fresh air, chicken soup, and tincture of time, and a little bit of a measure of luck.
The good news is viruses have a way of burning themselves out.
there is this push and pull between what we call infectiousness and virulence, and so there's sort of this dance a lot of times.
Yeah, I think that is accurate. If it's going to become more transmissible, the mutations that make it that way, usually it takes away from the virulence. I mean, this is a big oversimplification, but that's largely true.